Thank you, David. So as most people here are aware, we have access to two specific antivirals. One is an oral antiviral. It's a pill called Paxlovid. The indications for Paxlovid are for anybody who has a confirmed positive COVID infection within 5 days and are deemed to be at risk for progressing to severe infection. And that could be anybody over the age of 70, regardless of vaccination status. It could be over the age of 60 if you have less than 3 doses and have certain comorbidities, all the way to anybody over the age of 18 who could be at risk for severe infection from COVID and has either a known malignancy or an autoimmune disease or are on medications to suppress their immune system as a result. It used to be only accessible through our assessment center, which did limit access for the general population. But recently, within the last few weeks, the ministry has made it available to outpatient pharmacies. And we have a list of pharmacies that do provide Paxlovid. And there was information given to primary care physicians in the community so that any physician can now prescribe Paxlovid to their patients. What we found from personal experience is that some physicians are very comfortable prescribing Paxlovid and will prescribe it for almost any and all patients who have COVID, and some are still uncomfortable prescribing it themselves. So they still have that avenue of referring to our assessment center for access to the oral antiviral Paxlovid. One of the drawbacks to this medication is the fact that it has a lot of drug-to-drug interactions. So you have to be very well aware of all the medications a patient is on and ensure that there are no hard contraindications, meaning there are some medications that you absolutely cannot take with Paxlovid. Some are softer contraindications, meaning it might increase or decrease the levels of the other medication that they're on. So there is some knowledge that the prescribing physician needs to have to ensure safe access to Paxlovid. But that has been a major barrier, and really the only barrier. I mean, what's better than taking a pill for 5 days for treatment of COVID that you could do at home? What we have as a backup then to people who do not qualify for the oral antiviral is an intravenous medication called remdesivir, which we at the hospital have been using for some of our hospitalized patients now for some time. This is also accessible through and only through our assessment center, although through some finagling and a lot of hard work, especially from Karen Riddell, working with CCAC, we can give the first dose at the hospital and then provide future doses through CCAC at home for the patient. So that's worked out very well. Both of these drugs have been very effective at keeping people out of hospital. They are in the range of 88 to 92% effective at preventing hospitalizations. So they are really game changers when it comes to overwhelming our healthcare capacity. In terms of our personal experience at Windsor Regional Hospital, we've administered just under 100 doses of remdesivir so far, and just under 130 doses of Paxlovid. The remdesivir is a complete picture for our region. Paxlovid, of course, is not, because there are primary care providers and other physicians in the community who are prescribing it. So that number, I'm sure, is much higher. But that's been our local experience at the hospital through our assessment center.